If your vagina is having a fishy odor, my dear, don't be frightened. Don't be scared. It's a normal thing and it can be treated. Hi, I'm Nurse Bliss and this is my YouTube channel. Welcome back. And if you are new here, you're welcome. Kindly like, subscribe, and share. And don't forget to turn on the notification bell icon to always get notified on my new videos. Thank you. Now we're going back to what we started with. We're talking about bacterial vaginosis today. Bacterial vaginosis, which is BV, is a common vaginal infection caused by an imbalance of bacteria in the vagina. It occurs when there is an overgrowth of harmful bacteria compared to the beneficial ones. It is present with symptoms like unusual grayish white discharge, a fishy odor, and sometimes itching and irritation. Now let's talk about the risk factor of this infection. Now, several factors can increase the risk of developing bacterial vaginosis, including sexual activities. Having multiple sexual partners or a new sexual partner can elevate the risk of having bacterial vaginosis. Note, bacterial vaginosis is not a sexually transmitted infection. I repeat, it is not a sexually transmitted infection. Now, the second one is douching. Using douches disrupts the natural balance of bacteria in the vagina, potentially leading to an increased risk of bacterial vaginosis. Third one is IUD, intrauterine device. This device that women put into their vagina to prevent them from getting pregnant for about 5 to 10 years. Okay, women using an IUD for contraception may have a slightly higher risk. I repeat, slightly higher risk. And the fourth one is cigarette smoking. Smoking has been associated with an increased likelihood of bacterial vaginosis. So if you are a woman and you are smoking, I will advise you to stop smoking because it increases the risk of having bacterial vaginosis. And the fifth one is antibiotic use. Certain antibiotics can disrupt the balance of bacteria in the vagina, predisposing someone to bacterial vaginosis. While these factors may increase the risk of bacterial vaginosis, bacterial vaginosis can occur in women without any identifiable risk factor. That is what I said in the beginning of this video, that it is a normal thing. Now that we've talked about the symptoms and factors that increase the risk of bacterial vaginosis, let's now talk about the cure of this bacterial vaginosis. This infection is actually not that expensive to treat, and use antibiotics. Just antibiotics is the most common treatment for bacterial vaginosis, and the most common antibiotic to be used is metronidazole, popularly known as Flagyl. I am not telling you guys to go to the chemist and buy metronidazole and start taking it too. No, it is more advisable to go to the hospital to get a definite diagnosis. But antibiotics is usually the drug used in treating bacterial vaginosis, as opposed to VDC when you use antifungal drugs. Now, one particular thing you should understand about the bacterial vaginosis is that it has a tendency to reoccur, like it reoccurs. So if you treat it and still having the symptoms, just go to a hospital to get a proper treatment. Now that you know the symptoms, causes, and cures for fishy vaginal odor, I guess you now know what to do when you are experiencing such. Thank you for watching my videos. I hope you like it, and please subscribe and click on the notification bell as not to miss any of my videos.